Hello everyone, it gives me an immense pleasure introducing to you Dr. Fulvio Porta. Hi Dr. Fulvio.
Hi everybody.
So Dr. Porta is one of the pioneers in the field of bone marrow transplants. He is head in the Department of Pediatric Immunologist and Bone Marrow Transplants at Brescia, Italy, and he is a visiting consultant in the Department of Pediatric Immunology and Bone Marrow Transplants at AstraZeneca Hospital, Bangalore. And he's a person who has got 35 years of experience in the field of bone marrow transplants, has performed more than 700 transplants to date, and is available to us today, fortunately, to share his experience on the same. So, Dr. Porta, to our audience out there, can you explain what is bone marrow transplant?
It's a very important procedure that saves a lot of lives. It's been discovered and used the first time 50 years ago and saved the life of a child who had a severe immunodeficiency that now is a father of 2 children. So it was a great success. Ever since, thousands of transplants have been performed worldwide and is now a therapy of choice in several diseases. Why? Because several diseases can affect the blood. Bone marrow transplantation means to change the whole blood because there is a problem. Which problem? Can be different. For instance, everybody knows, and the name is terrible, is leukemia. But leukemia, if it's not cured with conventional therapy, can be cured by bone marrow transplantation, and the results are very good. But not only leukemia, even if the bone marrow doesn't work, so some of the cells of blood are not functional or not enough, we can just change the bone marrow and give it new.
Well, you have had 35 long years of experience in this field, and I should say the field has grown as you have grown with the field. So would you like to share how different it was 35 years ago, and have the results become different in the field of transplants?
The things has changed dramatically, this in a positive way, because 50 years ago they hardly know who was the donor for this child that became a father with 2 children, so it was cured. But that was possible because just the year before, a very smart doctor discovered compatibility. So discovered that bone marrow transplantation can be performed only by a compatible donor. And that was the assumption, so what they thought 50 years ago. And the progress went on, and this assumption is not true. We can give a donor to everybody now. What is changed dramatically? The fact that we can just find a donor in the family, can be one brother or sister that is by chance compatible. In a population like in India, where sometimes there are people that are married, people of the same family, it's possible that the mother and the father result compatible with the child. And moreover, we have now other chances. There is the bank of donors, bone marrow donors. In India, there are at least 4 banks, and it's growing, and growing the number of volunteer donors means adults that said, yes, if somebody needs my bone marrow, I'm ready to give it. And they are not giving it immediately. It's just a possibility. If one day, 10 years after, a child will be identical to the donor is called back and say, you sure you want to donate bone marrow? And he can save the life of a child without losing his. Because in other transplants like heart transplant, kidney transplant, liver transplant, always the organs are taken from somebody who unfortunately is not with us anymore. But bone marrow transplantation is an act of solidarity so big, you save the life of a person and you stay in hospital half a day and then you go home. So that is the most important change that has been done. But the second one is that the doctors became more and more good in assisting the patients. The antibiotics get better because to change bone marrow means that there is a part of the life of a person where there is no more the old bone marrow and not is not arrived the new bone marrow. This is 20 days where the patient who received bone marrow transplantation is completely without anything. At Astra Hospital, there is a specific unit that preserves the life of these patients, where bone marrow transplantation are regularly performed. And so the patients are absolutely covered and there's no problem. And this is another thing that changed in the old times when I started, because the isolation of the patient was not as good. Antibiotics, antifungal drugs, because this patient have fear of everything, every single virus, fungi, everything. So you have to have new drugs, at the same time new drugs, and we have new drugs. And this is the second item. And the third one is that now there is technology that helps us very much in transforming the cells, taking the cells of the donors, and that can be done here in Astra Hospital. You can just, into brackets, compatibilize the cells. Even if the donor is not compatible, our scientists in the lab, it takes hours, but after can give a suspension of cells. There is no harm for the patient, and they are in fact compatible.
Nice to know that. So what has happened over the last 30 years or more has not only changed the science, but I'm sure has increased the success as well in this field. What interests me is primary immune deficiencies. That is where I come across in this science. Now, when it comes to primary immune deficiencies, a subgroup of these patients do require a bone marrow transplant. And I'm aware that you have done more than 250 of bone marrow transplants only in immunodeficiencies. So how different are these children from the other children who undergo transplants?
I must admit that on these children, we maybe, just to be paradoxical, we mismanaged these children, because sometimes we didn't recognize they were ill because they presented with cough, gastroenteritis, they're infants, and so as doctors we think that's normal. An infant can have this, but doesn't have to last too long. So we have to be careful to the symptoms. And for a long time, these children died without a diagnosis, without being understood completely. Moreover, doctors were not good enough to read the blood tests and to just discover that sometimes these children do not have enough cells to protect themselves. So some children with immunodeficiency, and I told you that 50 years ago the first transplant has been performed in a primary immunodeficiency, a child who was born from a family that has a disease, and he didn't have T cells, didn't have the cells against normal infections. This child died within a year of life. So it's easy, because they fail to thrive, they are very thin, they do not eat, they are continuously infected. My primary immunodeficiencies are rare diseases, so they are not very common, but are very many. So few diseases, few cases, for many diseases. So this requires more attention. You requires a very good immunologist, a very good lab of immunology, as Astra Hospital can offer. This is one of his points more important. But as well, once you've done diagnosis, you always have to propose something. You can't go to a patient and say, you have primary immunodeficiency, goodbye. You have to say, what's next? And what's next is now more and more bone marrow transplantation. But we are discovering the indication, means who has to do the transplants. Every year, we have new diseases. What was the error I did in 35 years of my profession? That let's say 15 years ago, some children with certain diseases came to me and says, my neutrophils are not working. This is a famous disease, it's called chronic granulomatous disease. These children have very severe infection, but we thought they do not die within 1 year, they do not die within 5 years, so it's okay. They will live for a while. But that's a mistake, not for a while. The person has to live for good. And so if you do the transplant, you can save the life of these persons that normally have big problems by the age of 30, 25. So, as a young adult. So, as compared what we did 30 years ago, now we are more paying attention to what is the quality of life of this person. But why is that? Because once upon a time, as you say in the fairy tales, the survival of the transplant was 60%. Means you transplant 10 people, 6 survive, 4 do not survive. So for disease like this, that is not leukemia, that's not enough. So the techniques, the donors, the protection from infection, raised this curve to 90%. So if you can offer to a patient 90%, that's become very interesting. If you say, well, my disease, I can survive 25 years, or I do the transplant when I'm 3 years old and I have 90%, or we could for good. That's the major difference that happened in the years and within the years.
In certain cases of immune deficiencies, especially severe immune deficiencies, we see patients are brought in a sick state, and we often don't have time to get an appropriate donor for transplants. We look for the siblings, but there is no sibling match, and the bank takes a lot of time. In such cases of emergencies, what are your suggestions on transplants?
It's a very good question, because give me the opportunity to say that perform transplants in primary immunodeficiency is not easy, because as compared with leukemias, when they receive transplant, they are in remission, or they are at the maximum their strength, or when they are doing fine. Most of the time the child with immunodeficiency comes to us to receive transplant being infected, being unwell. So it requires a quick decision, and we have to find a donor as soon as we can. And so again, the technology, the new times gave us the opportunity to offer a donor to everybody. They are the parents. So we can always choose one of the two parents, and he will be an optimal donor. The results of the transplant from the parents now are more or less the same one of the bank. And again, here at the Astor Hospital, the transplant can be realized immediately.
Sure, good to know that.
Thanks.
Thank you. I think Dr. Fulvio Porta has made it very clear that as decades passed by, not only the indications of bone marrow transplants have changed, but even our success has changed. And today, many of our patients can be transplanted if transplanted at the right time with a success rate of around 90%. And with the guidance of Dr. Porta, with a lot of experience down there at Astor, I am sure we will be able to treat many more such children. Thank you, Dr. Porta. Thank you for your time.
Thank you.